Hi guys, welcome back to my channel. So today I went to AHEC orientation, the Area Health Education Center scholarship orientation. So I'm basically a second year AHEC scholar. So over here, this is the stuff that I got from the orientation today. So over here, I got the pin. Look at the design. It has like medical heart and cross. Uh, there's a the hat over here because again I'm expecting to graduate from the program this year, and some nice icons over here. Again, this is like for second year scholars, and I also got a pre-pen. I already have this one, but it's good to have an extra one. But the main thing today, I just want to show this one because it's really cool and educational. Also, this one is a Narcan, and then the other one is the Terra. So before I joined the AHEC, right, I have no idea what Narcan is and the Terra. But since I volunteer a lot during their community presentations and outreach programs, so I became more familiar with the programs and also the items that we give out to the community. So these ones are, if you're here in Florida, in Jacksonville, because we're over here, we give out like this ones for free every time we do a table setup. So this one is Narcan. So it's also like the chemical name is naloxone hydrochloride. So basically, this is good because this is for opioid overdose, right? So if somebody is overdosed with opioid, right? So this is like the reversal drug for this one. So if you give this to the person, right, it can save their life. Because I think they were explaining that it's example if you see somebody passed out on the floor, right, and you don't know what the cause is of the person being down, you can administer this one after calling 911, so that in case what do you call this? In case if they're not really a victim of opioid overdose, there's no harm. But if they are experiencing overdose from opioid, it can save their life. So this one is a intranasal nasal spray. So this is how to use it over here. There's a nozzle and there's a plunger. So again, you can't really like do a test before giving this to the person because it's limited amount. I know some example like fire extinguisher or other products. You can test it so that you would know if it's actually spraying or working, right? But this one, since it only has one nasal spray device contained, so it's only one dose of medication. So you have to push the plunger so that it can deliver on the nostrils. And then this is short acting. That's why you actually have to call 911 first, so that by the time that the medication wears off, then the person should be good because the medical team already hopefully are on scene, right? So this is the Narcan, and this one is the Deterra. So this one is really amazing as well. It just says here in the packaging also, deactivates drugs, safe, convenient, effective. Again, if you haven't heard this one before, and I didn't, for me myself also, I was not familiar with this product before I joined AHEC. So this one is example, right? If you have medications in your house that are expired, you can't just like throw them away on or flush them down to the toilet, because it can also spread like harmful chemicals to the sewage, the water, right? So that's why like this one is a good product because it can it neutralizes the chemicals that are on the medications, right? So over here at the back, it also explains you how to do it, like how to use it basically. So this one, just to tear it open, the pouch, and then once you tear the pouch, right, you fill the pouch halfway only with warm water and wait 30 seconds. After after the medication is already in the pouch. And after that, after 30 seconds, then you seal it. Then that's the time you can throw it in the garbage can over here, the garbage bin. The amount that you're able to um, deactivate for this one is either 15 pills of medication. So it can't really, like, if you have like a stack of pills like 30 or more, it's not going to be able to do it. Only 15 pills will be effective. And then 2 ounces liquid medication or whatever, yeah, that is. And or 2 patches, whether it's smoking patch, fentanyl patch, whatever. So yeah, it's really cool though. So I'm gonna keep this one in case of emergency, so that especially this one. Like I'll keep this one like with me on my car in case like if I travel, if I go somewhere and someone needs it, I can either administer this one myself or give it to someone who actually needs it for themselves or for someone they know. All right, it's really cool though. So it was awesome. Today was the orientation, and there was like we had a hands-only CPR and also substance abuse training. So both trainings are beneficial because hands-only CPR, it's kind of like leaning towards the approach is like when you're alone, most likely in a non-medical setting, how would you be able to administer CPR effectively and be able to save somebody's life? And then the substance abuse, it's just like I appreciate the data more on like how many people who struggled with substance abuse, and like we learned that addiction is not really a choice. There's like root cause of why people turn into drugs, and some of them are induced, right? So example, like they were medicated when they during their surgery, and then it kind of like got them and they became addicted. So it's not really like a choice sometimes. So, but the best thing is like aside from fixing their or treating their the addiction, also the behavior needs to be addressed as well. So they need to be counseled so that the behavior would stop, or at least like decrease in severity, and they be able to stop. Because like, what's the point of treating someone with addiction and treating them with the what do you call this, the symptoms, and then later on they come back to the same habit, and it's going to be a problem, a cycle of problems over again. But yeah, all right guys, that's it. Thank you for listening to me and watching this video. Take care. Have a nice day.